Welcome to the Ubuntu 2024 podcast. I'm your host, Dr. Joe Scott Jones, a rural GP from New Zealand. And the word Ubuntu comes from the Zulu and Xhosa languages and can be roughly translated as meaning humanity towards others, the belief in a universal bond of sharing that connects all humanity. I am because you are. Ubuntu 2024 is an in-person and online conference jointly held by the Network Towards Unity for Health, or TUFH, and Rural WONCA, the World Organization of Family Doctors Working Party on Rural Practice. Ubuntu 2024 will be the 45th anniversary of the Network Towards Unity for Health and bring the TUFH annual conference together with the 20th WONCA World Rural Health Conference. So quite a special occasion. It's going to be hosted by 5 partners: the University of Western Cape, the University of Cape Town, Stellenbosch University, Cape Peninsula University of Technology, and the Western Cape Government Department of Health and Wellness. So September 2024, Cape Town, South Africa, will see Ubuntu 2024 bring together health professionals, educators, and thought leaders from across the globe to explore the theme of people, place, and policy for community wellness. And today I'm talking to Steve Reid, who's a professor of primary healthcare at the University of Cape Town. Hi, Steve. I think we met in Sydney, which was a fantastic conference in itself. I love your background. Is that actually your office, or is that like one of these Zoom backgrounds that we can see there? That you actually have read all of those books? You've probably written some of them, I would imagine.
That's true.
I'm already feeling humbled. Tell us a bit more about yourself, Steve.
So I'm a rural family physician. I spent 10 years in a small district hospital, small by African standards. There were 250 beds. There were 5 or 6 of us doctors for 10 years with my wife. And I did that actually originally as a community service, as an alternative to military service.
Right.
So I was a conscious objector to the apartheid in the apartheid system, and we found ourselves not punished by being there, but actually really enjoying the work, incredibly fulfilled. So when I completed my time of obligatory non-military service, we stayed on for 10 years and had some children, and the rest is history. And I've ended up in the field of rural health, but from an academic point of view.
Was that something that you saw yourself doing when you started in medicine? Was that where you saw yourself being?
No, actually, I was. When I completed my final year, I was dead set on being a hand surgeon.
Right.
So I started specializing in hand surgery through the orthopedics route, but then the military got in the way. I ended up doing quite a lot of hand surgery, but not as a specialist.
Yeah. What was it that drew you into medicine in the first place? Were you inspired by people in your family, or was it
Yes, yeah. I mean,
why medicine?
My dad was a physician, but no, I think very formative experiences at high school, and just the sort of combination of the sort of academic, the curiosity of it, but also the very practical ways in which you can actually make a difference to people's lives. So that combination has always fascinated me, and I specialize in family medicine, so that kind of opened a whole another arena of possibility.
And what brings you joy in your work at the moment, Steve? What really?
My students. I love. Yeah. I mean, you could ask the opposite question. Say, what brings me tears? And
it's your students, I guess.
Exhaustion is management meetings.
Oh, okay.
Some do those. Give me a day of management meetings, and I'm ready to pack it in. But give me a day with students, and I love it. either postgraduate students, our registrars, or undergrad students. I take 4th years and 6th years on a rural platform, so it's often very sort of contextual, and that fills me with energy.
Mm. And I saw that you were the director of the Centre for Rural Health as well for a while.
Yes, in Durban, up the East Coast at the University of KwaZulu-Natal.
Yeah.
I started the centre as a research centre some years ago, and it's still going. But I'm now in Cape Town at the University of Cape Town. And in this building, actually, in this office, we're in Groote Schuur Hospital, the old Groote Schuur Hospital, where the first heart transplant was done.
Oh, wow.
Yeah, so it's quite famous for that event.
Yes, yes. So
Chris Barnard, do you remember the name?
yes, yes. Well, hopefully we'll get to maybe see it. That would be a bit of medical tourism. Do you have many people wandering around the outside taking photographs? Is there a statue?
Oh, absolutely.
Yeah,
they've recreated the operation with life-size mannequins in the actual operating theatre. So there's a donor theatre and a recipient theatre, and it's a bit spooky because it was 1967, so that's a long time ago.
Yeah,
50 whatever years. And these mannequins are so lifelike, it's extraordinary. But the whole story is quite extraordinary. Chris Barnard was a slightly larger than life. He lectured me when I was in final year.
wow. Wow. I mean, well, you've just, I was always coming to Ubuntu 2024 anyway, but now I've got an added reason for coming. And so tell us about the University of Cape Town, and particularly, and how how it connects people together and advances the health and well-being of the people who need it most in your community.
Well, my department is Department of Family, Community and Emergency Care, and we're very involved in community-based education. So our teaching platform extends right across the province. I've actually been involved in Rural WONCA for 20 or 30 years, so right from the beginning. And so I'm quite familiar with both TUFH and the rural working party of WONCA. And in contrast to the very highly specialized medicine that's practiced here at Groote Schuur, for example, the transplant section is still going, a very active transplant unit. Our work is much more community-based, primary care at community health centers, district hospitals. And you must understand that in South Africa, the district hospital, such as we worked at for 10 years, is run by generalists. So we did our own rural generalists. We did our own anesthetics, C-sections, ectopic pregnancies, tubal ligations, appendectomies, whatever was needed, and that makes quite a difference to the sort of scope of practice that's expected of a medic right out of their internship. So it's quite a challenge, and we find that our students are up for it, but the health system is struggling in South Africa and in many parts of Africa with the lack of resources, not just human resources, financial and equipment and infrastructure and all of that. We're relatively fortunate here in the Western Cape, the province of South Africa that the conference is in terms of those resources. But we certainly expose our students to the challenges, and I can say they respond incredibly positively, and that's what really motivates me, is to see how students navigate the difficult situations of particularly a lack of resources. Yeah.
And it's one of the things I find fascinating about attending these international conferences. I've been to a number of the Rural WONCA conferences, and you know, that comparing and contrasting what we expect of students and what we expect of ourselves as practitioners working in rural communities around the world. What I see is so much that. I mean, there are a lot of differences, but there's so much that's in common around those extended roles and the community service focus and passion that I see in the colleagues that I meet at the rural conferences. Again, one of the things I'm looking forward to for Ubuntu 2024. Just from your perspective, Steve, why should people come to Ubuntu 2024?
Well, I think if you want to see, not just hear, but see, because we're building into the program a quite practical aspect, was something I've always enjoyed about the TUFH conferences are the site visits built into the program, not as an added extra, but one of the days devoted to actually going to a community site. If you want to see how a system works in a very different context, how we support our clinical nurse practitioners, for example, or how we work with teams of community health workers who are not in the facility but are based in the community and doing home visits, etc. I think it's a really good opportunity. Plus, I must say, Cape Town is like a bit of a tourist destination in the world as a whole. I mean, it's just beautiful. I am a very keen mountain biker, and I get out most weekends for a good 3 or 4 hours of fun on the mountain. But hiking, etc., Table Mountain is, as you probably know, really beautiful. And so it's and then the beaches and the sea and the peninsula. So it's an amazing place to live, but it's even more amazing to visit as a tourist. So there's a thriving tourist industry, and so there's that side of it as well. And if anyone is thinking of coming, I would say stay an extra few days and book a tour or two, because it's really worth spending time. And just to add, Joe, that we have organized a post-conference tour that kind of takes in a bit of the medical side, but also the tourist attractions up the east coast, going towards what's called the Garden Route for 3 or 4 days. So that is the optional extra. And we're just in the process of putting out a flyer about that. And it's obviously an extra cost, etc. But Ian Cooper and I have put together this tour out to a town called George and back again 4 days later. Yeah.
Fantastic. And will we be visiting some of the medical facilities and meeting some of the clinicians that are working in those communities?
Exactly. We wanted it to be something that the people's partners also enjoyed. So not all work, but some, whale watching or Kango caves or whatever, the touristy side, and at the same time as visiting the students who will be on site during that time, and their preceptors, their supervisors, getting a feel of what a South African district hospital looks like, feels like, who's doing what, that kind of thing. So yeah, that's an optional extra.
It's a fantastic. I would strongly encourage people to do this. I did it in the Philippines, and it was an amazing addition to the conference. And getting being able to see the people working in those communities, as you said, you get a really deeper understanding of the way that the system works, from actually being there and seeing it and meeting the people. And it's we did it in Brazil as well, which was again fantastic. So Thank you, Steve. That's absolutely inspiring. I've got tingles down my spine. Looking forward to September 2024. To find out more about Ubuntu 2024, visit the website ubuntu2024.com. And Steve and I hope to see you there. Ka kite anō.
So I want to say in our
yes.
local language, in Zulu, Ubuntu is a shortened version of the Zulu saying Umuntu, ngumuntu, ngabantu. So Umuntu is the Zulu word for a person.
Right.
And then the second word is ngumuntu, is a person. And then the third word is ngabantu, by virtue of other people. That's the direct translation. A person is a person by virtue of other people. So we shorten it to Ubuntu. Umuntu, ngumuntu, ngabantu.
A person is a person by virtue of other people. I find that
That's right.
I find that quite profound, and because I'm sure that it resonates with many of us in the health professions. That this is that we make connections, and connections are absolutely core to our effectiveness, and I think to what brings us joy in our work as well, is that making of connections with people. So a person is a person because of other people.
That's right.
Yeah, that's so even more inspired, Steve. Thank you so much, and we'll see you in September next year.
Next year.